Hi guys, good afternoon. Welcome back to my YouTube channel. Hope all is well and everyone is doing amazing. So today I have a video on some home health aid exam questions. These questions are the ones for the new year. So and another thing is to overcoming test anxiety. So we need to overcome test anxiety and pass the test in flying colors. So that being said, we are going to be diving into the different tests. So we have a question here. You notice family members giving a resident extra snack that conflicts with the diet order. What do you do? So what do you do as a home health aide? Do you ignore to avoid conflict? Do you report to the nurse and remind family about the dietary restriction politely? Or do you confiscate the snack? Or D, encourage more to make resident happy? So this is not a difficult question. You can get it. So the correct answer for this question is B. Report to the nurse and remind the family about the dietary restrictions politely. Let's look at another question. Ordering a resident pain level. Best practice is to use the resident's own word and standardize pain scale. B. Assume age means less pain. Estimate low score. Only document if pain is severe. Or D. Record caregiver's opinion rather than a resident's report. As we know in the class, we always say pain is a subjective data. And we cannot make up stuff for people pain. So it's what the patient tells you. So you have to use their own words because the pain, the way you describe your pain might differ from another person. So A is the answer. Overcoming test anxiety, guy. Pass the HHA test with confidence. Which observation suggests possible sepsis in a resident with UTI, urinary tract infection? Think about this question. It is not a difficult question. Is it stable vital signs and clear mentation? Low-grade fever only, hypotension, tachycardia, and acute confusion. This is the classic sign when a patient has urinary tract infection, specifically geriatric, older patients. Your blood pressure is going to be low. Tachycardia means your heart rate is above 100 beats per minute, and they tend to get very confused. So C is the correct answer for this question. Question. I hope that's not the end of the slide. I have more slides here. Question 4. Which action is appropriate when a resident's prosthetic limb needs cleaning? So we know due to diabetes, patients' prosthetic device, they wear a prosthetic device, and because of the amputation, oftentimes they might wear a prosthetic device, and the home health aide must clean the device before applying the device on the patient. So do you clean the limb only when the residents ask? B. Clean per manufacturer's facility instructions and handle prostheses respectfully. Use hot water and harsh chemicals. Store on the floor to save space. So guys, any product that you use or anything that you use, you always have to use the manufacturer's specifications. So whatever they say, that's what you have to use. B is the answer. Question 5 and 6, a resident wound dressing is saturated and leaking. You should first reinforce the dressing and continue with routine. Remove the dressing fully and leave the wound exposed. No. Notify the nurse immediately and follow spill precautions. So the correct answer for this one will be is to notify the nurse and follow the spill precautions, because the nurse have to come and reapply the dressing. We don't do dressing changes as a home health aide. It is outside the scope of practice. 6, when caring for a resident on contact precautions, you must wear gloves and gown when entering the room for precautions and remove them before leaving. So you don't walk around wearing the same glove all around. No, we don't do that. So it's A is the answer. Question 7, a resident complains of chest pain and is diaphoretic. Diaphoretic means sweating. You should ask about the pain characteristics, call 911 per protocol, and monitor vital signs. B, give them aspirin without checking orders. Encourage them to walk to distract the pain, or record in a chart and continue routine. The correct answer is A. Obviously, you have to call 911 and you have to try to stay with the patient and try to monitor their vital signs. Question 8, which is the correct technique for cleaning from the inner to the outer eye? This is like when you're doing a partial bed bath. How do you clean the eye? Clean from the outer to inner to remove tears. Use the same corner of washcloth for both eyes, or clean from the inner to outer using a different section of the each wipes. So the correct answer is C. The resident is going to be moved to a hospital. What is the first documentation that needs to be completed? Is it A, incident report only after transfer, complete nurse assigned transfer checklist, record vital signs and belongings? That's the only one that makes any sense. B. B is the correct answer. You observe another CNA taking a resident's money without permission. You should. Guys, we know this one. This one is you have to report this immediately to your charge nurse. You don't sit around and see someone does something. In New York, you see something, you say something. Question 11. Which sign is most characteristics of sensory aphasia? Inability to move arm, fluent but nonsensical speech and impaired comprehension. C, complete mutism with intact comprehension. D, involuntary tremors while speaking. The only one that makes any sense there is B, fluent but nonsensical speech. This is a common thing that occur with patients that that had a stroke. a cardiovascular accident. They do suffer from aphasia and dysphagia. All of these are complications of a stroke. Guys, please drop a comment on this video and please give me a like and a thumbs up, and let me know in the comment section of the video what other videos you would like me to provide for you. I am focusing on doing only home health aid exams and CNAs, Prometric exams. So that's what this channel is all about. Thanks for watching and catch you in the next video. Bye for now.